Meditronics Healthcare.
Welcome viewers. Home ventilator. In this video we will understand what is a home ventilator, how does a home ventilator works, when is a home ventilator used, benefits of using a home ventilator, types of home ventilators, when to consider a home ventilator, challenges of using a home ventilator. What is a home ventilator? Home ventilators provide more comprehensive respiratory support for individuals with chronic or severe respiratory conditions who have difficulty breathing on their own. These machines are designed for use outside of hospital settings, allowing patients to receive critical respiratory care in the comfort of their own homes. How does a home ventilator work? Delivering oxygen and removing carbon dioxide, the ventilator supplies air, often enriched with oxygen, to the lungs, and assists in removing carbon dioxide from the body, which is crucial for patients with inadequate lung function. Mechanical breathing support. Depending on the patient's needs, a ventilator can either fully control the breathing process or assist the patient's own breathing efforts. Customized breathing cycles. The machine is programmed to deliver breaths at a set rate or in response to the patient's attempts to breathe, ensuring appropriate oxygen levels and ventilation based on individual requirements. Interfaces. The ventilator delivers air through either a mask, non-invasive ventilation, or a tracheostomy tube, invasive ventilation, depending on the patient's condition and level of respiratory support required. When is a home ventilator used? Home ventilators are prescribed for individuals with chronic respiratory failure or diseases that impair lung function. Common conditions requiring home ventilation include chronic obstructive pulmonary disease, COPD, neuromuscular disorders, central hypoventilation syndrome, chronic lung diseases, severe sleep apnea. Benefits of using a home ventilator: enhanced quality of life, improved breathing and oxygenation, 24/7 respiratory support, reduced hospitalization, customizable settings, non-invasive and invasive options. Types of home ventilators. Non-invasive ventilators, NIV. These ventilators use a mask to provide breathing support without the need for invasive procedures like intubation. They are often used for patients with conditions like COPD or mild neuromuscular disorders. Invasive ventilators. These ventilators provide more advanced support and are connected to the patient via a tracheostomy tube inserted into the windpipe. Invasive ventilation is used for patients with severe respiratory failure or conditions that affect their ability to breathe independently. When to consider a home ventilator. A home ventilator is typically recommended when a patient requires long-term respiratory support due to a chronic condition, has difficulty maintaining adequate oxygen levels or clearing carbon dioxide from the body, experiences frequent hospitalizations due to respiratory complications, can benefit from round-the-clock monitoring and support at home. Challenges of using a home ventilator. Caregiver support. Patients on home ventilators often require assistance from caregivers or family members to manage the equipment and monitor their health. Risk of infection. If a tracheostomy tube is used, there is an increased risk of infection, requiring careful cleaning and monitoring. Cost and maintenance. Ventilators are advanced medical devices that require regular maintenance and, in some cases, power backup systems to ensure continuous operation. In conclusion, home ventilators provide life-saving respiratory support for individuals with chronic or severe respiratory conditions. By delivering controlled airflow and maintaining oxygen and carbon dioxide balance, these devices enable patients to live more comfortably and independently at home. Whether non-invasive or invasive, home ventilators are an essential part of long-term care for those with compromised lung function. We will be back soon with another video. Till then, take good care of yourself as well as your near and dear ones. Thank you for watching.